Welcome to the Health Update. I'm Paulina Riojas. Here with me is Dr. Aarti Raja, Mako Media's Health Adviser. Welcome, Dr. Raja.
Thank you very much, Paulina. Happy to be here.
Our topic today is the end of the COVID-19 public health emergency phase. Dr. Raja, what does that mean for all of us?
So this can mean many things for the public at large. So up until now, we have been under what's referred to as a COVID-19 emergency phase. It went into effect January of 2020, right around when the pandemic began, and it is due to end May 11th of 2023. So what it can mean is there'll be a lot of changes in place as far as COVID-19 treatments, COVID-19 vaccination availability, and just how people will access treatment needs for themselves.
How will this impact free vaccines and testing in South Florida?
Sure. So up until now, if you wanted to get a vaccine for COVID-19, there were set locations where we could go and get vaccines for free, and everyone could get that. Anyone who was a citizen in the United States could go get that. But now that the emergency phase is coming to an end, there are now going to be changes. So for example, as long as you have health insurance, you can go to your health insurance provider as long as they're in your network. And if you go to someone who's in your network, the vaccines will still be covered for you through your health insurance. Now, if you don't have health insurance, this is where the changes start becoming visible. If you don't have health insurance, then you are most likely going to have to pay for obtaining that vaccine. And then for the older population, people who may be getting covered by Medicare or Medicaid, there are going to likely be some changes for them as well in terms of where they can go to access the vaccination and which locations it will be covered and free for them, so to speak, and which locations, if they end up going to, they'll actually have to pay a charge for the vaccines.
Is this a big thing? Is COVID-19 cases going down? What are the stats with COVID-19?
Sure. So oftentimes people can misunderstand thinking, oh, the emergency phase is done, which means we're done with COVID-19. We don't have to worry about this ever. But that is unfortunately not the case. COVID-19 cases have plateaued in the United States, which basically means that there isn't a sharp rise in the number of cases. But that doesn't mean that the cases have completely gone away. The virus is likely still around, and people have to kind of start thinking about this like the flu. Every year we know and we understand that the flu season is during these certain months, and there is a likelihood that people are going to see flu cases. Now that's going to be very similar with COVID-19. There are going to be times of the year, most likely in the fall, right around when flu happens, that you will also likely see COVID-19 cases. So we just have to be aware of that and know that it still is around. The removal of the emergency authorization just is an indication from the government or the country saying we're not in that pandemic phase, or we're not in that phase where we're really worried about a sharp rise in the number of cases and severity of these cases. And that's all it means. And it also just means that the government is probably moving funds around for a variety of other projects and not putting all of it only in this one basket. So they're kind of saying, well, it's no longer COVID emergency phase. We're now transitioning out of that phase, and that's all it means.
Thank you for clarifying that. Do you have any last thoughts?
My last thoughts again would just be for any individual to always be aware about their health insurance or health related information. If you have insurance, become familiar with what your insurance covers and what they do not. And if you do not have insurance, start looking up information about where they can get appropriate treatment information and where they can go to obtain vaccines and treatment.
Thank you, Dr. Raja.
My pleasure, Paulina.
This has been the Mako Media Health Update. I'm Paulina Riojas. See you next time.